So I'm going to kick off today's webinar. I have to tell you, my name is Ann Lenahan, and I was really happy when Dr. B reached out and asked if I would moderate and open and close this. But I also want to acknowledge I never knew that my heart would be so heavy today when I was asked to do this. And we want to start out acknowledging the horrific massacre that occurred in Uvalde, Texas, which has many Head Start centers, early Head Start centers. We know that many families woke up without a brother or a sister or a parent or a child. And the grief and the outrage, I think, is felt all around the country. It is always so difficult when something like this happens to acknowledge it and then try to pivot into the business that we are about to do today. What I can say is and it's not okay. These tragedies are not okay, and we have to do a better job as a country and as individuals. And I have seen Head Start communities go through tragedies that they should never have to experience. And we know Head Start often takes a leadership role, but we also know Head Start needs to take care of itself, its families, its staff, who are also hurting during these times. So with that, why don't we just take, just a moment of silence, and however you think about this or grieve or pray, let's just take a few moments, and then we will resume. Okay, let's begin. This really is a timely topic. I think early Head Start is almost 27 years old now. It's getting up there. And I know that the numbers of early Head Start programs have grown, but we also know the need, just in terms of numbers of unserved infants and toddlers in this country who are below the federal poverty guideline, is just staggering. So this is an opportunity for us to listen to some real life experiences of how they got there, how they make it happen. And also we have a colleague from our regional office, from our headquarters in Washington, DC. So I don't want to take much more time. I just want to turn it over to Karen A., who's going to start out and talk about strategy.
Thank you, Anne. Hi, everyone. It's hard to be a Texan today, so thank you for acknowledging, as we all sit here today, thinking it could be very different. But so I'm Karen A. I am in the Tarrant County area, so Fort Worth DFW area, and we have a Head Start, early Head Start, and an expansion program. And so I'm going to share a little bit about strategy and kind of where did we get here? Why did we get here? And to encourage you to kind of think about that. And so if you knew anyone here, you would know, like, everyone's like, man, she's always strategizing. So my theory in life, because I came from public accounting and I worked in a lot of businesses, and then I spent a lot of time in nonprofits, is that I often saw organizations that were doing great work, doing really great work, but their environment was changing. And when their environment was changing, they didn't necessarily move as quickly as they could have, just like a for-profit entity might or a business might. And so they were missing things that were happening in their world of expertise that they were serving in that they could have done better or more work. And so that's kind of how I view strategy. And in that, you take data. So where do I start? How did I get there? Is when I came to the organization about 6.5 years ago, we were starting to see in our area that we had ISDs going to universal pre-K. There were some changes happening in the longer days served in the area. And so we were just watching what was happening. So we were watching a couple of things. We're watching true data, right? So your enrollment, your eligibility, what's happening there, are your numbers rising? Is it really easy to obtain all of the families needing served? Because what we do know is the people are there, the families are there that need the services, but are they coming to our program? And so we just started watching a couple of data points. One is that. The second's what's happening in the environment, what's happening in not only just early Head Start, but also childcare, pre-K, anything that's in that early education realm is what we were watching. And so as we were seeing things change, I was like, man, do we need to start shifting? Because we were having a harder time. Our wait list was much smaller. And why was that happening? So a challenge, I guess one of my challenges is the why. What's happening? Why is it happening? And how do I need to change? And so we kind of looked at that. You'll often hear me say at this organization, like, man, what's happening today? But really, where do I need to be? And where does this organization need to be in 1 year, 3 years, 5 years, 10 years? What are all those different pieces that are happening? And so what does that mean, right? So 6 years ago when I came, we started seeing this more universal pre-K. We also saw charters entering this area. That wasn't something that we had seen a lot. And so we may have had a facility on A Street, and right across A Street, there was a new, very large facility going up that was serving other children. And that may have been an ISD, could have been a charter. It's just a lot of different things were happening. And so we were seeing families make different choices, and we were trying to figure out, well, how do we keep competitive? Because we know, right? Everyone on here knows we do a great job. We have one of the best programs in early education, because we not only do early education, but we have this amazing wraparound services that we can provide. And not all programs have that. And so we kind of started thinking about that. I have a theory of 3. So as I'm thinking about strategy, I'm like, we definitely need to change. How do we go about doing that? And so for me and our team here, we were thinking about 3 different ways. Do we do it on our own, right? I'm just going to do it on our own. We're going to convert our own slots and we're going to do everything on our own. That's one option. Option B was, how do we get those buildings, right? Some of our largest challenges is like, you got to convert a building. So how do you get your buildings? Well, that's maybe a community answer. That may take a while. So you're working on that. And then the third was, well, how do we just use our partners? So can we partner with ISDs a little bit differently and not view it as like a competitive, like you're taking mine, like this tug of war, but really like, how can we embrace a partnership to serve children better, right? And so we kind of took these 3 approaches, and I have a theory of 3. I think if you launch 3 things, 1 will probably surely happen, 2 maybe happen, and then maybe you might get lucky and all 3 happen. And the greatest thing of serving more children works out. And so we kind of started that 6 years ago. And in about year 2.5, we started having some really good conversations in the community and the ISDs, and we were successful to really negotiate those conversations where the ISDs were entertaining the concept of, oh, you guys really do bring something different that we don't have. And that was because we were strategizing with them on the very special things that Head Start has with this whole family approach, right? So we've been doing early education for a very long time. What did Ann say, like 26 years? We've been doing it for a really long time. So we're really great at that. But what ISDs may have, they've been doing it for just as long, if not longer, but they maybe have not been doing that wraparound service of those family engagements and parent engagements and really this enriched environment of pulling families in. Because what we do know, right, from data is if parents are involved, the children are going to do a lot better. And so we started bringing those to the table, and that's been very successful. One model that I would say is probably our most successful in that is we have a couple of partnerships with ISDs where we provide 1 certified teacher at pay equity and 1 TA. And then on the other side, the ISD has to provide a certified teacher and a TA. that teaching team of 4, they go to all the ISD training, they go to all the Head Start training, each are equally involved. Now, that's a great model. The other side of it is it's a lot of work. You have to make sure they're meeting all the pre-K standards, they're meeting all the Head Start standards. So you're constantly working this wheel. But at the end of the day, who benefits is those young children. They're getting a really rich environment. The parents love it because they have one drop off. So they can drop off there. Why am I telling you about that model? Because that model allowed us to convert at a much lower rate. Because I could save some cost on those children. That way, as I was paying one teacher, one TA, I was able to convert at a lower rate. Why am I telling you that? Because often you sit here and you're worried. You're like, man, I'm going to have to convert 1, 2, 3, whatever that number may be in order to have the cost model that works for early Head Start. If you can think about different models and different ways of doing it, you may just find yourself not as concerned about the number of children you're losing, but what are you gaining? And so I always try to think about what's that positive, because when you think of conversion, you think, man, I'm going to lose, I don't know, a Head Start class, and I'm only going to, that's, 17 or 12, whatever that number may be for you. And I'm only going to gain 8 over here. So there's a delta. But you can lower that number if you have different strategies. And so that's what my encouragement would be, is to really think about, if I do it on my own, it's one way. If I do it in partnership, it's another. The third arm would be the community. If you can get your community to rally around this, you may get a building, land donation, other things that help offset those costs. Because what we all know as accountants here, right? Anything that I can have someone else pay for is a win in my bucket, because that just means I'm giving way more money to children and to the teaching teams that we really need to help serve these young children. And so those have been some strategies that have been really helpful for me and our team here. The other encouragement, I can tell you, I started 6 years ago. That first year I started talking to my program specialist about it. Maybe I was naive because I didn't know, but I was like, hey, I think we need to do something. So what I would tell you and encourage you, and I'm sure people on here would probably tell you the same, is just have that open communication with your regional office. I talk to them frequently, probably more than I should, but mostly because they have so much wealth of knowledge. I think about just me as a sole person, I only have so much knowledge, but they've been doing this oftentimes their entire life. And so reach out to them. They're a resource to you to help you. And it's been a pleasure to work on that with them. And it's success for them too, because they see success in the community and they're getting to live it out through us. And so that's really great. And I can encourage you, we're starting to think about it again, because, where we're at, state of Texas is pre-K is universal everywhere. We just had another ISD launch that. And so our world is changing. So where do I need to be in the next 2 years? Where do I need to be in the next 5 years? Because Head Start's relevant. And I want to make sure that we're constantly at where we can serve the most children possible in partnership with others. Also just providing those families such care. What I can be proud about is that it's we're seeing really great things come out of some of the partnerships that have birthed from a conversion. One of those is we even have like a early Head Start center within an ISD, and from a parent's perspective, they love it because a parent only has one drop off. They go to that one school, they're dropping off early Head Start, they're getting to meet, they're having engagement, their children are going to school more frequently. That's one thing Head Start's really great about, is like the encouragement of attendance, and that just becomes a built model. Then when they're transitioning to pre-K really well, or Head Start, depending on how that model works. And it's just been a real pleasure to see some of the data points come off of that. So I think that's my spill. I would just encourage you to think about it and base it on data, and then keep that regional office in the loop, because they're definitely your friend in this matter. They've seen it, they know it, and they can really help you. So I'm going to pass it over to Michelle, and she can talk about actual logistics. If you want to.
I have a question for you though, before we got a little bit of time.
Okay.
You were talking about that delta where you're losing X number of children, and because it's obviously conversion is not a one-to-one. How did you have difficulty convincing the governing bodies, including the policy council, that it was okay to be serving less children overall?
Man, you do have, I don't know if it's difficulty or if it's just uneasiness, right? Because you're like, man, I have, I'll just use 10 children and then I moved to 8 children. And they're like, but what about those other 2 children? What we really worked on was those partnerships. We still wanted to ensure that if we converted and if we had 2 children that weren't in the Head Start, early Head Start program, they were in another program. Like, we ensured that. So we kind of timed ours differently. So we took the children that were going to move to pre-K, and we made sure that there was not an excessive amount of slots that outweighed those. Like, we didn't want any child transitioning throughout I'll call it the fleet of slots, that there was no child dropped. And so that gave a lot of comfort to our policy council and also our board. We also started talking with them a lot of years before. So they knew, like, this is what's happening, and they could also see it in their center. So we had a center where their child had gone there for a couple of started there in early or had their first year in Head Start. When that school got built across the street, they did see an impact. And they were our best resource of data as to why. Like, why is that happening? They're like, oh, I just want one drop off. If I can just go in one lane, then that's great. And then we're like, oh, okay, so we just need to think through that. Can we solve that problem? Maybe that's one option. But if I can't solve that problem completely, maybe it is better to convert. And if they had 2 children, one that's young and one that's older, maybe they do have a way of putting that in, because you often don't have an ISD that serves the early Head Start age. So it can be advantageous in that way for a family to see that across the street. So we try and work in concert, but it's a great question. You do have to, open communication. So let them make the decision. Like, it's really their decision as policy council to approve or not approve. And so if they have the data points, they'll probably get to the same conclusion that you're getting to if you're really sharing the data well with them.
The whole issue of doing something, even regardless of the conversion, you're doing something that's meeting parents' needs.
Mm-hmm.
It's just so critical to this process. And I kudos to your organization.
Well, it takes a village for sure. So it is, everyone has their hand in helping. So any other questions that may pop up, or if we want to let Michelle tell you actually how to do it? I just told you a bunch of theories and what works. Now you got the real meat of the story.
Well, thank you, Karen A. Great information to consider and great encouragement there. I am Michelle Boatwright, and I oversee programming at CAP Tulsa. We're located in northeastern Oklahoma. So we're a part of Region 6, and we currently have 2 OHS grants. We have a Head Start, Early Head Start grant, and we also have EHS childcare partnerships. And like many Head Start providers, we offer other programs and services. We're a community action agency, and for about 15 years now, our state has had a private and state-funded program to expand and enhance early childhood services. We benefit by participating and administering that program. We get some additional funding, training, and other supports through the Oklahoma Early Childhood Program. And I share that now because when I share some information later about our total capacity and then what of that is Head Start, Early Head Start, it kind of helps to put the story together. So to provide a little more context about our agency and who we are, we currently have the capacity to serve 1,928 children through center-based and home-based services. We operate at 11 different schools, and we have 144 classrooms during this school year. And I would say that our home-based services are both early Head Start, and then we have some maternal, infant, early childhood home visiting funded slots. So again, because all of our numbers won't perfectly match up between here and some later slides, I'm just sharing that we have some other funding sources. Our schools are located across 3 different districts in the Tulsa and surrounding areas, and we employ 630 staff agency-wide. like Karene's organization, we used a lot of community data, of course, as required. And that data showed that the majority of the 4-year-olds in our community were enrolled in some type of programming. And at the same time, the public schools were adding pre-K capacity, much like Karene suggested. We were seeing charters and seeing so much more coming into our community. In certain parts of our service area, we had little or no demand for 4-year-olds, and some of that was true for 3-year-olds as well. And in those particular areas, once the program year began, it was virtually impossible to backfill any of our enrollment opportunities with 4-year-olds. So we contemplated conversion for several years before really having the solid data and submitting a request. And we submitted an application amendment. And we did that in September of 2019. And that was shortly after we submitted our continuation application. Our intent was to be prepared to convert over the summer months and to begin operating more early Head Start rooms in August with the start of our 2020-21 school year. I'll also say that as I was looking back over the information for today, I was reminded that our request was submitted and then our request was pending during that beginning part of the pandemic. And so there were challenges and there were also competing priorities while we were awaiting approval and implementing. But I'm not planning to go into details about those pieces of maybe challenges or solutions. That could and has been a webinar topic on its own, right? The table we're looking at here shows, go back to 4, please, sorry. Just to talk a little bit more about over time, I just wanted to show that prior to submitting our request, we had about 3 times more Head Start slots than we had early Head Start slots. And then after we completed our conversion request, you can see the difference in 2020-21. And then I'll just note that in 21-22, we were able to really balance out more what we were offering for early Head Start and Head Start, but also share that we were successful in getting some expansion funds as well as adding some more EHS CCP slots in 21-22. So that helped us with balancing out as well, in addition to requesting some additional changes through a competitive application. So moving on to the next slide, once we had submitted our request, we used a timeline that we prepared to guide our continued planning and preparation. And we had, of course, discussed conversion with our program specialist for some time, and we'd received guidance on the type of application and the timing. And we remained in regular contact, like Karene talked about doing, with our program specialists. We communicated to staff about the possibility of the conversion as we were planning, and we'd shared similar information with staff that we'd shared with our board and our policy council. And then we just kept everyone apprised of any of the new information that was coming along as we checked in. During this time, we were also offering opportunities for staff with preschool CDAs to obtain their infant toddler CDAs. We were asking who might be interested in working with different age groups. And we were seeking understanding about which staff might be open to transferring locations. We had previous experience with renovations and new constructions, and we'd always used a cross-functional team approach to plan for openings when we were adding those facilities. So we took a similar approach for conversion, since we had to plan for when rooms would close and when they would reopen and everything in between, from ordering cribs to ensuring diapering space would be adequate to making sure that our new EHS rooms were staffed and our agreements were adjusted as needed. On the next slide, we have an example of the timeline that we submitted with our request for conversion. It is pretty basic, and we did use it as we were getting started, but then of course we came up with more detailed task and timelines, and we assigned certain owners and more specific dates, as well as the ability to track delays or remaining follow-up items. And as I said before, our request was submitted as an amendment. We did not submit it with our continuation application, but I may not have shared that our grant cycle is January through December. So we submitted in September, knowing that our grant cycle was January through December. And then when we were working through the process, we did have to submit a prorated budget. So we had a call with our regional office in January of 2020. We walked through our request, answered some questions that the team had, and in March we were asked to submit that prorated budget because we would be implementing in the middle of our program year. So I think anxiety came up earlier about deciding to submit a request, and I think even with the best data that shows the need, it is hard to accept that the total number of children and families served will decrease. We all want to serve more and more families, as many as we possibly can. And so that part, it just doesn't get any easier, no matter what point of the process that you're in. And even with a good timeline, expect that you're waiting for a decision and you're trying to remain flexible while you're keeping good backup plans on hand.
Michelle, could I ask you to clarify one thing that I
Sure.
think might be helpful? When you show that original chart, you had 3 program years funding and how the slot shifted from Head Start to early Head Start.
Yes.
So it crossed over multiple budget periods.
It
Correct?
did.
That evolution. But was your plan that you submitted to the regional office, was it all in one request where you had this vision across these programming or budget periods, that it all emanate from that one request, or were there multiple conversion requests? I think that's what I'm trying to get at.
Sure. So we submitted in late 2019, knowing that we had already submitted our request for 2020, and we were hoping that we could convert for the starting of the 2021 school year. We went in with a pretty small request. We stayed under that 10%. We requested to change I think it was 86 Head Start slots to 40 early Head Start slots. And then we knew that we would probably be making another request at a later date. I think Karen A mentioned that they will probably do the same. So it was always our intent to get our feet wet and then go in with another request a little later, because we knew we needed to continue that process. Does that answer?
Yeah, thank you. Thank you.
Yes. If we can move to the next slide, I'll just talk a little bit about prior to notification. Our team was meeting, the cross-functional team I mentioned, we were meeting at least twice a month. We were establishing those next steps. We assigned someone who pulled that team together regularly, tracked the information. Just to tell you a little bit about who was included, we had directors of schools, directors of impacted service areas like health and family support, leaders who were overseeing facilities and operations, as well as IRSI, information technology staff, of course, human resources team members were there. And then we thought it was super important to keep this team together and have this systematic approach that we came to the table each time to talk about what we were doing next. So for example, each time we met, different teams would report out. HR would be first on the list, and they might provide an update on the number of staff interested in qualified for the planned EHS rooms, and then so on. And as the different teams reported out, it would lead to questions, it would lead to problem solving, and then likely new tasks that we needed to complete, right? And our plan definitely included where we were closing and opening rooms, and we were ideally looking for staff who would volunteer, who were interested in moving or changing to a different age group. And if we did not have those who stepped forward with that interest, then we did use tenure of staff. So those last hired maybe the ones, their rooms would be those, selected first at the particular location where we were planning a conversion. And then I would just say that one neat example of an adjustment that we made is near the end of the school year, we did have 1 or 2 situations where we learned that teachers weren't returning for the following year at a certain location. So we took into account where staffing vacancies would exist, and kind of last minute, we made the choice to change on the same side of town. We had 2 schools where we were making some conversions, and we switched out classrooms we were converting just to reduce their disruption and to take advantage of where we knew we would have a vacancy. And then in terms of facility factors, I would just say that, like many of you, some of our schools are previous elementary schools, and closing a 4-year-old room does not, always mean that you can convert that exact room into an infant toddler classroom. So we did have to look at repurposing rooms in some buildings and using space in other buildings nearby. We also moved some classrooms around to keep some of the infant toddler classrooms and the pre-K classrooms together in the same area of a building. And then on the next slide, after conversion, we knew we would have fewer children and families served across our system. So we definitely looked at what the different configurations of the classrooms would be. And we asked our teams to take a look at their assignments for family support workers, health associates. Did we need as many assigned to certain schools? Did we need to move some to other schools? And really wanted to adjust as needed with our staffing. And then regarding some of our partners, we let the public schools know that we were making adjustments, that we planned to reduce the number of Head Start children served. That might have a slight impact on the number of referrals we were making for testing. And we kept in touch with our Part C agency, Sooner Start, to let them know that we were planning to serve more children under the age of 3, and we wanted to encourage them to keep those referrals coming our way. And then on this next slide, just to wrap up, once we received notification, that was in late April, and we were thankful to receive the news at that time. Typically, we begin registration for the next school year in March, and we like to get our calendars and our other information out at that time. So we wanted to get moving along. I think in our timeline, we thought March would be the date, but April still worked. Some of our staff are off in June or July or both, and we definitely wanted to make announcements and finalize plans with any impacted teachers prior to their time off. So because we had done all of the planning beforehand, our communication was prepared, and we sent it out quickly to staff, and those other pre-established plans were set into motion. Purchasing had prepared orders that were needed for classroom supplies. They were submitted. Our teams were able to move forward with contacting families. Licensing was contacted to change the numbers and the numbers for our childcare licensing, and staffing plans were finalized. And I'm happy to report that we were able to begin placement with the families in June, and we were prepared to serve the EHS children in August. So with some slight adjustments, we definitely we stayed on track as best as we possibly could.
Michelle, I would just like to ask you to comment. You talked about obviously needing more early Head Start teachers. Did any Head Start teachers have to be terminated in the process because they were either not qualified or were unwilling to become qualified in toddler services?
They did not. I mean, we were able to deal with most everything through attrition. There were teachers who were interested in moving to another school. We have most of the conversion that we did were on the east side and the north side of town. And so it was pretty simple to talk to staff about going to a location that was literally a few blocks away. And so many staff that needed to move around did that. And we did have a few who received their infant toddler CDA, and then they moved into an infant toddler classroom as opposed to staying in a Head Start classroom. If there aren't any other questions right now, and I'll definitely look at chat. I will pass it on to Larissa with the Office of Head Start, and she can speak more from that lens.
Wonderful. Thank you so much, Michelle. And this was great. I got a little thing on screen reminding me to unmute. That was helpful. I just want to start by saying that I am so happy to be here. I get very few opportunities to interact directly with grant recipients after many years way back as a program specialist. So I'm delighted to be here with you and to talk about one of my favorite topics. So if we could just go to the first slide, please. Or I mean the next one. There we go. Thank you. So I'm going to speak a little bit about some of the basic requirements and considerations for conversion requests. And then I have a little bit of a roadmap to share with you to tell you about what the process is at the federal level. So starting here with conversion request requirements, a reminder or information for folks who aren't familiar in terms of grounding. The Head Start program performance standards at 1302.20 talk about the required elements of a request to convert enrollment slots from Head Start to Early Head Start. There are 9 specific elements, things like describing the numbers of slots you'll change, describing how the kids in the community will be served through other parts of the program or other programs, describing whether and how you're going to serve pregnant women in your program. So that is a pretty good roadmap for at least some of the things you need to put in there. I cannot emphasize enough, and I was so glad to see Karen A start with this, that it's all based in your community assessment. It's all based in your program data. So that is really your starting point. Having that information, doing the kind of observation that Karen A talked about, that was a really nice grounding that she provided for you. And then in the context of that, looking at those requirements to put your application together. So the second point, grantees need to formally request a conversion of slots through an application in HSES. It might be through a non-competitive new application, or it might be through a non-competitive continuation. But it also, as Michelle described, can be done through an application amendment. The important thing is that you document it early so that there's a record and so that you can begin discussing it with your regional office, and also that you submit it at a time that gives you enough time to answer questions, to make clarifications, to have any kind of back and forth that might happen with your regional office, and still get an approval in time for it to be a good conversion in terms of minimizing disruption for the children and families in your community and in your program. Much of the time that means, similar to how Michelle described, that you plan a transition for over the summer, because sometimes you have a break in programming, you have more time to give staff training if they need training in working with infants and toddlers. Usually that's a good way to map it out. It doesn't mean it's the only way. But the critical part, again, is to make sure that you begin early, talk with your regional office often. One of the things that can really help move an application along in a more timely manner is if your program specialist knows everything that's going to be in it before it even comes in, and you've already worked through a lot of the questions and a lot of the thinking about it, then that can really help expedite the process. Let's go to the next slide, please. Okay, considerations. I touched on this first one a minute ago, but just really can't say it enough. Propose changes to your programs, whether it's Head Start to Early Head Start, changes to your program options, whether you want to move slots home-based to center-based. It all really needs to be justified by what you see in your community assessment data. And so it's really important also and required to have that assessment data be up to date. Right now is especially important, right? Because programs have been through a lot and communities have been through a lot of changes with the pandemic. Some of those are permanent changes in your community. And so if you're considering building an application for conversion at this time, you really want to make sure that you're using up-to-date community assessment data. With that, the second bullet, it might seem a little bit confusing. I'll do my best to articulate, you do want to make sure that your requests for conversions are based on actual changes in the community and not based on anticipated changes. And what I mean by that, and this is just one specific example, we often have programs say there's more and more pre-K in the community. We know that there's going to be other sources of services for preschool, and we think it's going to be X number of slots next year. Sometimes that works out, and sometimes that changes along the way. We don't want you to apply too early based on what you think might happen, because if it doesn't play out that way, you may end up that you didn't have as many slots freed up and you still have greater needs. So it's a pretty delicate balancing act. And again, I think an ongoing conversation is what's important. Budgeting. This is my second sort of hot point that I really cannot emphasize strongly enough. Your budget should be based on the planned services and slots. Back in the day when we started Early Head Start and we didn't have a lot of knowledge yet about the actual costs, and we sort of needed to predict and figure out, there were numbers that were thrown around about conversion ratios and cost per child and all those kinds of things. But we have learned over time that those are two ways that are not strong and effective ways to build your budget. It should not be based on a preconceived conversion ratio. If you've heard 1 to 2, 1 to 3, whatever, forget all about that, please. And it should not be based, like if your cost per child is $10,000 in Head Start, and I'm just winging it, making up a number there, that has much less than you would think to do with what your cost will be or should be in Early Head Start. What we want you to do is build the budget for the program that you want. And so with Early Head Start, for example, if you want and your community needs center-based Early Head Start services, you might start from realistically, what kind of space is available or could be created in your community? How many Early Head Start center-based slots can you serve, in that available space? And then that might tell you, okay, this is how many children, how many slots. We know that we can have that the ratio that's expected is 1 Early Head Start teacher to 4 Early Head Start children, except in some cases where it's even lower. And we know that we can have a maximum group size of 8. So we know how many classrooms we have. We know how many children we can put in them. As a result, we know how many teachers, permanent teachers, we're going to need. Then we're going to have some kind of margin of floaters that we need. Then we're going to go into other things like supplies and equipment and whatever else. But when you build it that way, you end up actually having the cost to do the services that you want to do. If you build it based on converting a Head Start cost per child, you might shortchange your Head Start program, because how much money is actually freed up from your Head Start budget depends greatly on where the kids are coming from. If you close a classroom, then you free up the salaries of those 2 teachers from that classroom that then could serve, towards salaries of the new Early Head Start classroom. But if you're going to just pull 20 slots and 2 of them are in each of 10 classrooms, you're freeing up no funds at all, practically. So it's really important to understand how those work and not shortchange your existing Head Start and not build your EHS or to build your EHS on the true picture of what you need to provide the services that you want to provide. And Anne says she has a question.
So Larissa, and one thing that I think is a challenge for many programs, and I know Michelle and Karine both touched on facilities. If I'm a program and I can demonstrate through data how much we need, to convert because of the need, in Early Head Start, and actually we may have a community where there's less need for Head Start, but I can operate the program showing you the budgets. I really need some one-time funding to address some significant, programmatic issues, or whether it's retrofitting or even a new building. So how does that, would you say, if you haven't got it all figured out and the space is not available, then don't submit. So what is the thinking in an OHS on that scenario? Because I think a lot of programs do struggle with that.
Sure, absolutely. So there are a couple of things. One is, to put the time into exploring your community where there is space that might exist, where there is space that could in theory be converted and that would be suitable, and where there is no space, but maybe there's a place where you can put a building. Those are all reasonable options. What's tricky is programs can at any time request one-time funding for projects that are one-time costs, and a building or a renovation would fall into that category. We accept those requests all year round. So whenever you know or you think that that's what you're doing, you can submit that request. That doesn't mean it's going to get funded immediately, but it's there sort of in the bucket for consideration with what we have. And then your program specialist, your grant specialist being aware of that, when we find we have money, we know who needs it. So that also comes into the early communication. Another thing that can be really helpful, not necessarily on the big ticket items, but on creating some one-time funds, is if you, for example, you want to begin to serve some infants in September. You could request that your conversion be approved for, say, April or May. If you don't recruit or fill staff or have all your expenses until September, some of those unspent funds from the conversion can be used for those one-time costs on the front end. So that's a pretty complicated concept for us to get into with the tiny bit of time we have today. But I think that was a really great question, and important, again, to know that these are things where your regional program specialist, your regional grant specialist can help you really think this through. Okay, I'm gonna just get back on track because I know we have really limited time. Not that that was off the track, it certainly wasn't. Ongoing communication with your regional specialist, we already touched on that regarding your data and proposed changes. So let's go ahead to the next slide, please. Okay, so here's what happens once your request comes to the Office of Head Start through an application, whether it's a full year application or a supplement. Your regional program specialist is the first line in terms of analyzing that application. They're going to check and ensure that the requested change meets all of the programmatic and fiscal requirements, that it includes the data necessary to justify the request, and all those pieces of information that, again, you can go back to the performance standards and also to the application instructions to make sure you have the right pieces in place. Anything that is unclear or that is absent, your program specialist is going to come back to you. You might have some back and forth to answer questions and add clarifications. And again, I just want to emphasize, the more you can do that before you even submit the application, the quicker the process is then going to go once you do submit it. What happens once your program specialist gets that application in the regional office is there's a couple of different pieces to the route that an application may take. Changes of less than 10% of the funded enrollment in Head Start can be approved in the regional office. So they analyze them there, the regional program manager approves them, and you are good to go. But there are a number of categories that are a little more complex or a little more significant, where the regional office does the analysis, they make a recommendation, and they submit that recommendation to central office, where we have staff in program operations in central office who then review the request and the information that comes from the regional office. So I put down here for you, and you're going to get this PowerPoint, the different reasons why they might come to central office. One is if you're looking and proposing to change more than 10% of your funded enrollment slots. Or if you are a small program, and the way that we have defined that for this specific purpose is if you are a program of 10 or fewer classrooms and you want to implement those services making a change to more than one of those classrooms, it comes to central office. If you are requesting to implement early Head Start services for the first time, you've done Head Start for years and years, but you've never served infants and toddlers in your agency, those requests come forward to central office. And a big part of the why behind that is that we look a lot closer to make sure that the proposal incorporates understanding of the differences and what it takes to serve infants and toddlers, because it's a very different proposal. And then the last one, which has been on pause for a while, is programs participating in the full enrollment initiative. We've had lots of programs prior to the pandemic who were in the full enrollment initiative and who, based on the data and the children in their service area, said, you know, a conversion would help us solve the problem of under enrollment in Head Start and meet the need or more of the need in early Head Start. Because of the scope of that full enrollment initiative, all of those requests also came to central office. So what you need to know there too is, obviously, if it's going to come to central office, it's potentially going to take a bit longer, but it doesn't have to be a lot longer if it's a solid, clear application. Let's see what I've got left. Not too much. Okay, so this is the little roadmap that I talked about. And it just kind of goes over some of what I already described, but it's a handy little picture for those who are visual learners. Starting in the lower, I guess it's my lower left, completing and reviewing the most recent community assessment, self-assessment, all of your program data. Then step 2, sharing the findings with your board, your policy council, your staff, talking about what does it show about your community, what's needed, would it make sense to make changes in your program? Step 3, you start talking with your regional program specialist, your regional fiscal specialist about your potential proposal and thinking it through together. Step 4, you submit that application, minimum of 90 days before the planned implementation date. Step 5, this is the piece I just talked about. If it's less than 10%, the regional offices can approve it. If it is larger or meets some of those other conditions, they make a recommendation to central office, and central office makes the final decision. And then this last step on this slide here, which is very important to know, is the decision is not official. You do not have official permission to proceed until you have a notice of award that confirms that it's been approved. So that is what I've got on slides. I apologize, I'm a couple minutes over. I think there are some questions in chat, probably for everyone. So I'm going to point back to Anne and to my colleagues here if you want to call those out for whoever may be able to answer them.
Larissa, I think there is an important one for you. And Ashley asked about our regional offices and a pause for these requests at this time. I'm not sure if the pause was related to the full enrollment initiative, which we know is paused, but our conversion requests on pause.
Across the board, we are not in a pause on change in scope requests at this time. You can request them at any time.
And could you tell us a little bit, you did mention the grant specialist and fiscal specialist, so I'm curious as to what role folks should anticipate that person plays who partners with the program specialist. And I see Karen A smiling, so she might have had some interesting thoughts about that.
Karen A, if you want, you can jump in first.
Oh no, I'll let you jump in first. No, everything was great. Yeah, it's just a lot of communication. I mean, constant communication, just so you get it right, because no one wants to go back and forth once you're starting to submit. So if you can get it right on the front end, everyone wins.
Thank you. Yes. So what I will say is that the role of the grant specialist in the regional office is the same as it always is when you submit an application for your funding, for one-time funding, whatever. The program specialist and the grant specialist should be working in partnership to review your application. If there are questions that are specific to budget or some of those financial rules, then they will work in partnership and potentially communicate with you together. And I would just emphasize that it is no different than what should be happening at the program level where if you want to write an application that's going to be successful and sustainable, program director, executive director, your program side staff, and your fiscal staff or your fiscal officer should be working together on that from the very beginning as well.
Thank you, Larissa. And I don't know that there are any unanswered questions. I think the virtual conference staff have been great at providing answers for a lot of the questions. So I think that we probably, with a little time left, can sort of begin to bring it to closure. And I had sort of a funny thought, not so funny, but thought as you were all presenting, and you talked about, everyone talked about the data and the documentation and the justification, how important it is. And I was thinking about the difference between family planning and planning for early Head Start conversion. I mean, a family decides, do we want another baby? And based on all sorts of factors, they make a decision. In this case, babies already exist. They're all over the place. I think the question for the agency is it the right thing for us to do to figure out a plan where we are going to serve the children, as infants and toddlers, who are already existing in the community and who are grossly underserved? So it's a little bit of a nudge, but I think it's an important discussion that every program, should be having. Especially, again, we know what's happening with many of our Head Start programs across the country. And of course, we know that there are Head Start zealots out there that say, but nobody does preschool better than Head Start. I think, for me, we have to figure out what's best in totality for the community. And even though you might think, you know what, some of those Head Start programs, some of those preschool programs are just fine. We need to maybe influence those programs, do things around parent engagement that Head Start does, but we don't want to discount the existence and the opportunity that those additional preschool slots give Head Start to think more broadly about, really broadening that birth to 5 organization. So I know we're coming right up on time. I want to thank all of you. It's great to see you. And the participants, I hope this has been helpful. My heart was so heavy at the beginning of this, I actually forgot, and Courtney is wonderful. NHSA, in response to what has happened in Texas, is doing a webinar that starts at 4 o'clock tomorrow, and that is the link for it. And it's responding to Uvalde, but it's really about trauma in young children. And many of you probably have heard Ellen Galinsky's name before, and she is heading up webinars. So we encourage you to share that with your program staff and your families. This is something that impacts every one of us, and it's gonna, I think, and it would want to say, well, these webinars like tomorrow are an immediate response. I think we as individuals and as organizations have a collective responsibility to do everything we can to help figure out how to make our country safer for our children. We're reminded today that the leading cause of death for children age 1 to 19 is our guns. So it takes heart, and it also takes action. And that's true for just about everything we do in our Start and Early Head Start community. Your heart and your action and your commitment every day make a difference. So we are incredibly grateful that our presenters, and incredibly grateful for those that had the time today to join us. And Larissa's saying, oh my heavens, are we going to get an onslaught of conversion requests? Well, you just might, Larissa. We know you can handle it. So I want to thank everybody.
That's okay.
Thank you. And I know that Dr. B, do we have anything we want to advertise as coming up?
I really think focus on tomorrow's webinar is the key thing right now. It was really amazing. I put in the chat. I mean, Ellen, I contacted her at like 2 this afternoon, and she dropped everything to come see us tomorrow. So She has incredible background in this area. So I think focusing on that right now makes the most sense, but certainly stay tuned. We've always got new opportunities for you.
Yep. And I hope you lead with the confidence to say, we can do this. So thank you very much. And on behalf of NHSA, have a peaceful afternoon. Thank you.
Thanks, everybody.